Somebody flip slides for you.
No, I'm gonna use this. I'll use the slide clicker. I'll come back here and deal with this. We'll just go outside and do some prep.
Traverse City, I have no clue. Where I live, in my town, Elk Rapids, in the summer, it's about 3,000 to 4,000. In the winter, it's about 1,000. We live in a very touristy area. Everything is very like, I don't know, it's just different. It's like old Victorian houses. They're all rented out for people who, come up for the summer. And, I don't know. It's very different. There's trees, like real trees everywhere, not palm trees or phone pole trees.
Right.
That's the weirdest thing I've ever seen. You can decorate cell phone pole and make it a tree. But no, like most of the people who live in my town leave for the winter. And most the average age of the people that live in our area are over 60. We have 2 elementary schools, 1 middle school, 1 high school, and the graduating class is usually less than 100. So there's not a lot of kids.
Right.
Yeah, it's a lot of older generation population. But it's also nice because, like, I can send my kids downtown to go to the beach or go bike riding, and I know that, of course, there's always risks, and there's people that come from out of town, but most of the time, like, everybody's looking out for everybody. Everybody, oh, that's so-and-so's kid, we'll make sure that they're okay. It's just different. 4 years.
Yeah.
And then I'll go home.
Yeah.
It'll be nice.
Yeah.
Why did you guys come out this way to Texas?
I like mountains. San Antonio doesn't have mountains. And we work from Texas, so
Yeah,
the military brought us here.
yeah.
But
Do you like it better than Texas?
yes,
Yeah.
that's nice.
I was stationed at Fort Polk.
That's like football.
I hated it
You did what?
because it was too freaking hot.
Too hot?
I was pregnant with twins at Fort Polk.
Oh, okay.
The food was delicious. They know how to cook.
Mhm.
People in the South, I went to culinary school. I love it. In fact, Sunday we're having butter beans for dinner. I'm like super excited.
Well,
Butter beans.
I didn't tell the place butter beans in years.
My best friend's mom's visiting here, and she's from Alabama.
Mm-hmm.
And I love butter beans.
Okay.
No one in the north, I can't even get them shipped to me in the north. I had to have my friend's mom send them to me.
Mhm.
So good. And then I also like both baked potato chips, pink hot dog, beef brisket. I had never, when we were stationed in Fort Polk, there was this Chinese buffet.
Mhm.
And the one thing that they made, other than the buffet, was baked potatoes that were like, as big as your butt.
Mhm.
And they had like cheese and sour cream and broccoli and all this stuff. And then they put barbecue beef brisket. And
happening today, is that we now have assets.
All right. Good morning. Can you hear us okay? All right. Outstanding. So I'm trying to do about 10 different things here at once, but we'll make this work for you. So, hey, good morning. Thanks for coming out and joining us at the VA Southern Nevada Healthcare System for our quarterly Veterans Town Hall. We do this in partnership whenever we can with the Southern Nevada Veterans Community Engagement Board. They are our community partners. That organization is run by about 50 different, well, it's a group, it's run by the community, and they have about 50 different organizations that are part of that. And they provide a variety of services to our veterans that sometimes the VA can't provide, and family members and caregivers as well. So, and they, like I said, about 50 different organizations. They focus on a variety of things: health and wellness, transition, employment, education, all those different services that we try to connect veterans with, or their family members or caregivers. So today's event that we're doing outside is our transition fair. So what we're trying to do this quarter is connect veterans, specifically, you know, especially those younger veterans who are service members, still maybe getting ready to just, you know, to leave active duty from the military, or maybe have left the military within the last couple of years and they're here in our community, but they're still trying to connect with resources in the community. That could be some of our community service providers, or that could be the, you know, with the VA, you know, how do I file for benefits? How do I file for healthcare, enroll in healthcare? How do I access my education benefits? So that's some of the things that we'll be doing today. So there'll be a workshop in here this afternoon that'll start about 12:30 and run to 3:30. And we have representatives from benefits, healthcare, and education that will be here to speak to those issues and help people specifically. So if you're interested in any of that, you are welcome to stay here for that. So what we're doing now is this is what we try to do is our quarterly town hall as part of these activities and events. So that is our opportunity to sit down with you and give you an update on kind of what's going on within the VA. So we have representatives from the VA Southern Nevada Healthcare System, as well as the Reno Regional Office of our Veterans Benefit Administration. So to my right, or my left, I don't know what, to your right, and to my left is Peggy Kearns, who's our director of the VA Southern Nevada Healthcare System, Mr. Alan Shockley, who is with our Veterans Benefits Administration here locally, and Dr. Ramu Kamandori, who is our chief of staff. So the three of us are going to do the best we can today or the three of them are going to do the best they can today to give you some updates on that. Now I want to speak a little bit about our town halls. If you've been to other VA town halls, I don't know, they may do their activities a little differently. Our VA town halls, our veterans have asked us to make these educational and informational events and to keep them kind of focused on things, but also provide education and information on individual type issues or questions people may have. So we do not get into privacy issues here. We will not talk about people's personal issues or personal medical things here. If you have a comment or a question, Dave Martinez and John Scott, John's on my right here, Dave Martinez is here. They have comment cards, and you're welcome to fill those out. Now that serves two purposes. One is we can look at that, and if there's something that we can take and address kind of in a general nature, or something to talk about how we can be doing better, or what we're doing, or areas to improve or suggestions, we will talk about that here. If it's your personal issue about your personal medical situation, we're not going to talk about that here. But we want you to fill out the card, because somebody is going to talk to you about that, and we're going to get back to you very shortly with the right representative. Now, we do have representatives from the VA out in the main hallway from about 20 different services here. So everything from pharmacy to enrollment, patient advocacy. We even have HR out there if you're interested in learning a little bit more about how to apply for a job, so with the VA. So we have a variety of services out there that might be able to help you today too. So Dave and John are going to look at those cards, and if they see that there's something that maybe we can't address up here, but maybe we have somebody either in the building or outside that can help you, we're going to try and get you connected to that service. And if we can't do that today, we're going to get back to you. So that's why we ask you to fill out the card. Also, it helps kind of allow us to keep the discussion on track and kind of keep it professional and allow us to address everybody's needs here so that you hopefully walk away informed and educated about your VA. So that is the ground rules and kind of the background of what we're doing here today. So I'm going to turn it over to Ms. Kearns and let her kind of give you a brief update on the healthcare system.
Good morning. So first of all, I do want to thank all the vendors. I know they're out there, but it is so great that they're willing to come on a Saturday and offer all of what they have to offer to all the veterans. So I did go to each table and thank each one, but I just wanted to do that publicly too. So I've got just a small little presentation to go over with you here. So you got the clicker? Yeah, go ahead. So just wanted to review what has happened over the last fiscal year. This year we treated 63,000 veterans. That's about a 2.8% increase over the year before. Right now, our growth since the start of the fiscal year, we're at right about 4.5%. So we continue to grow here, and I don't know how many of you know this, but down the road from here on 215, they're going to be building about 8,000 houses over the next 10 years. And so that's going to mean even more veterans moving in. So this facility is going to continue to grow, and that's one of the things I'll talk about in a minute. Last year we did 910,000 outpatient visits. Our average wait time for scheduled visits is 90% is in 30 days or less. Those are for our established patients. Our new patients, we're still having a little trouble getting people into primary care. Primary care is very difficult to recruit for. And one of the things I'll show you in a minute shows where we rank in Nevada for trying to recruit physicians. We did 42,000 almost emergency department visits. We have the 5th busiest emergency department in the VA. And we did 5,600 hospital visits, hospital admissions, I should say. Next. Okay. So on December 11th, Dartmouth University published a study that found that VA hospitals outperform private hospitals in most healthcare markets throughout the United States. And what we provided for you here on this slide is how we compare against hospitals here in town. So this is data they collect. It's called Hospital Compare. You can actually go online. It's the hhs.org, .gov website where they look at, you can look at any hospital in the United States and see how they compare on different measures. Things like heart attacks, infections, and a variety of other things that shows. And you can see that we rank very favorably against the hospitals here in town. So that was good news. And then the Journal of the American Medical Association had an article just published January 18th where they attempted to look at wait times. Private sector does not publish wait times. We do, but the private sector does not. This study was not done in Las Vegas. It was done in 10 major markets like Atlanta, New York City, Los Angeles, Seattle. But this is where we have issues. So if you look at that last bullet on there, Southern Nevada ranks 47th for physicians, 48th for nurses, and 50th for behavioral health. That is our ability to attract those kinds of providers. So this is a challenge for us here, is to try to get enough physicians and nurses here to take care of the growing population that we have. We are the 10th fastest growing VA in the country. So, and what I just told you about 8,000 houses, we're going to continue to grow here, which is a good thing, very good thing. So I will tell you that because of our growth, we're going to be building 2 new buildings here on campus. Between our boiler plant, which sits out east of the facility, and the Fisher House, we will be adding another primary care building because we have pretty much maxed out our 4 clinics in the 4 corners of Las Vegas. And we'll be building a new women's clinic with their own entrance and everything out in that same area. So these projects are under design this year, so we'll start design this year, and construction will start sometime more than likely in 2020 and finish in 2021. So that is really good news for us because I didn't think having a brand new hospital that we would fare well in the competitive VA budget to get more buildings. But obviously they've realized we're growing and that we need to add these buildings. So we have some others in the horizon for the future that we're going to be asking for also because we do have land here, which is one of the nice things that we do have. I've worked at many VAs and this is the first one I've worked at that had land to be able to expand on. So good news for that. All right. So this is something you might be very interested in. This is the Mission Act, and this is the new standards proposed. Let me say that again. Proposed standards that were put out on Wednesday. I believe it was Wednesday. So under the Mission Act, there are 6 different eligibility requirements for community care, and you only have to meet one of these. So you don't have to meet all of them. You only have to meet one. The first one is services unavailable. There are several states that don't have a VA hospital. New Hampshire, Alaska, Hawaii doesn't have one. So they automatically qualify for community care. If the service is not available, say we don't have a cardiovascular surgeon, then we can send you out to the community for that kind of care. The 40-mile rule, if you live more than 40 miles from a VA facility, not necessarily a hospital, but a clinic also, they will be grandfathered in from the choice program for 1 year. And then they'll meet criteria based on services unavailable or one of the other criteria that's here. We will have access standards, and I'll go over those in a minute. And also, if you, in consultation with your physician, have a need that we can't meet here at the VA or a need that we can meet better in the community, then you and your physician will talk about that, and we'll send you out to the community to get that work done. And then the last one is if you need care from a VA medical service line that is not meeting quality standards. I cannot tell you what that means yet because they have not outlined that yet for us. So we'll have to wait and see on that one. So next one is on the access standards. So the access standards they're basing this on are based on Medicare and what private hospitals use. So the VA didn't make this up. They actually adopted it from private industry standards. So for primary care, mental health, and non-institutional care, a 30-minute average drive time standard and a 20-day appointment time, wait time standard. So we're going to change from 30 days down to 20 days. And for specialty care, a 60-minute average drive time and a 28-day wait time is proposed. Anybody who can't access care within these standards would be able to choose between us and the private sector.
Does that include primary care?
Yes, I said primary care, mental health, and non-institutional extended care. So yes, it does. Good question. All right, next. Urgent care walk-in visits. This is something new. Every veteran will be allowed at least three walk-in visits to like a CVS or whoever is in our network once we get our network done. If you are copay exempt, you get 3 visits, and after the 3rd visit, it's $30 copay. If you have to pay a copay, you'll pay $30 every time you go to the CVS or the Walgreens or whatever is that urgent care that's out there. So this is a new benefit. I mean, this is new. So I can't tell you a lot about how it's going to work, but we'll get you more information as that happens. And these are for covered services that are not emergent. So it's not going to the emergency room. It's going like you have a cold or you think you have the flu or something minor, not something major that you would go to our ED or another ED for. And there's the other part of the eligibility is that you must have accessed VA healthcare in the prior 24 months. So those are the proposed standards, and I'll tell you that the Federal Register will open soon for comment from veterans, from whoever wants to make comments. It has not opened yet, but you can go to federalregister.gov, and there'll be a 30-day comment period on these rules. So they're not set in stone yet. but we'll know by June because we have to implement the Mission Act by June.
And I think, Director, a couple of important things there is it doesn't mean that you're going to get care in 28 days or 20 days in our community. It just means that you have the option to make that choice. So, you know, the VA may be able to get you in 21 days for primary care, but then if you go access that community care standard, it may be 90 days. So it's very important to remember that, especially when we were talking about the number of day or the kind of where we rank as far as physicians, nurses, and behavioral health specialists in this areas.
And our community care staff here has a good idea of what the access out in the community looks like. And they keep track of the top 10 providers that people go to. And so they will also be in the loop of saying to the veteran when it's time to schedule the appointment, oh, by the way, I forgot to add in that with the Mission Act, we'll no longer have Tri-West as an intermediary. We'll be making the appointments for veterans. So you won't have to get a consult or get an approval, and then Tri-West gets it, and then they call you, and then we'll be doing that. So when they call you, they'll be able to tell you, I can get you in 40 days in the community, and I can get you in here in 42 days. So then it'll be your choice of what you want to do.
Right. All right, so that's the director's update. We're going to move to Mr. Shockley here. Now, Alan Shockley, I know you're just kind of pulling double duty today because this isn't your regular, and Alan is with our Veterans Benefits Administration Regional Office, but Alan has the pleasure of working with our student veterans most of the time. He's down at UNLV as our lead down there. So Alan, if you could just talk a little bit about what you're doing and give us some brief updates on what's going on with VBA, that'd be appreciated.
Sure. Again, Alan Shockley. I am the Vet Success on Campus Counselor out at UNLV. I work for Vocational Rehabilitation and Employment Services here at the hospital. I've been with the VA roughly about 10 years. I come from a military family. I spent 22 years in the United States Army National Guard. My father was in the 82nd Airborne and retired out. Every male member of my family has served in the United States Armed Forces. I like to think I speak your language, and I'm one of you because I'm an 80% rated veteran myself. Many of the things that you have gone through in applying for your benefits, seeking a rating in order to apply those benefits, I've been right where you're at. I know a number of the pitfalls that go into it. Am I the VBA subject matter expert? No, but I do and can point you in the right direction and put you in contact with the people inevitably that can help you to help yourself. And that's really our goal in vocational rehabilitation and employment services. Normally, the educational services like Montgomery GI Bill or Chapter 33, the post-9/11 GI Bill, gives you up to 36 months of benefits. Voc Rehab, we go a little bit further because inevitably we give you 48 months and inevitably giving you the skills, abilities, and knowledge to take those out into the community and give you back your life and put you into the community. We put you in touch with community services and inevitably help you, again, to help yourself. Now, again, I am not a VBA subject matter expert, but again, Renee's in the back. If you do have a specific question in regard to VBA services, again, I will do my best to help you out in any way. If at the end of this, please come and talk to me. I'll give you one of my cards. I may not know, but I will know where you go to get your information so you can make this happen for yourself. One thing that impresses me that I have seen as to put you back into the community, give you those skills, abilities, and knowledge. My father, unfortunately, died when he was 56 years old of alcoholism back in the day when they had a thing called battle fatigue. We probably would call it post-traumatic stress today. With those services today, there's a great chance that our veterans inevitably will come out of that hole that they're in, inevitably find ways of